like about being a pulmonologist is the complex problem solving, as well as the fact that I get to help people. And oftentimes it's in a very immediate gratification kind of way, in that when somebody's short of breath, they're stressed out and they're having trouble breathing and very unhappy. But if you can fix that problem for them and they can breathe more easily, generally they feel a lot better. You can see it immediately and you can go home feeling like you've helped somebody. The advantages of practicing medicine in a smaller community are generally that if you run into problems or hiccups, usually it's easy to find who you need to talk to fix those problems, as opposed to a large community where you lose a little bit of compassion and humanity. You become almost more of a number rather than an individual. Practicing in a smaller community, there's more compassion, things are more humane, and it's harder to get lost in the system, for lack of a better word. I think internal medicine requires one to think of the whole person. As every organ system can be thought of as one system, but together as a system, everything works and kind of cross-talks in your body to keep you healthy. And a lot of internal medicine is recognizing where some of those systems misfire or miscommunicate. And with that, you have to sort of understand all of them, and I like that aspect of it. Specializing in internal medicine, and specifically more so pulmonology, the types of complex diseases that I might help patients with would be things like COPD, asthma, pulmonary edema from heart failure, shortness of breath, something called interstitial lung disease. Generally speaking, anything that affects the lungs, which can involve a lot of diseases that aren't specific just to the lung. And so trying to manage those diseases without offending or exacerbating any of the patient's other predisposing conditions is what I would specialize in.